What is pulsatile tinnitus and why do I hear my heartbeat? Imagine hearing a rhythmic sound that perfectly matches your heartbeat. It might feel like a whooshing, thumping, or throbbing noise in your ear. This is what pulsatile tinnitus is, a special kind of ringing or noise that pulses in sync with your heartbeat. Unlike regular tinnitus, which often sounds like constant ringing or buzzing, pulsatile tinnitus has a clear physical cause linked to blood flow in your head and neck. When you experience this, you're essentially hearing your own blood moving through your vessels. You can often confirm this by feeling your pulse while listening to the sound. They usually match exactly. Sometimes, a doctor can even hear the same noise with a stethoscope placed near your ear. This helps distinguish pulsatile tinnitus from other types, which only the person perceives. The main difference between pulsatile tinnitus and regular tinnitus is its origin. Regular tinnitus is thought to come from how your brain interprets sounds it receives, often without a clear physical source. Pulsatile tinnitus, on the other hand, has a real physical cause: changes in blood flow or blood vessel structure. When blood moves faster than normal, such as during exercise or pregnancy, it can create more noise. If blood vessels become narrowed or develop abnormalities, the flow becomes turbulent, producing the rhythmic sounds you hear. These sounds can be described in many ways. Some people hear a whooshing sound that matches their heartbeat, while others describe a thumping or throbbing sensation. Some might hear a high-pitched ringing like a tuning fork or a low-pitched marching sound. The noise can be loud enough to distract or even overwhelm you, especially if it persists. Pulsatile tinnitus is not a disease itself but a symptom of underlying conditions affecting blood flow or blood vessel health. In about 70% of cases, doctors can find a specific cause, but in the remaining 30%, the reason remains unclear. Common causes include increased blood flow, which can happen during intense physical activity, pregnancy, or fever. Conditions like anemia, where red blood cells are low, cause the heart to pump faster to deliver oxygen, increasing blood flow noise. An overactive thyroid gland, or hyperthyroidism, speeds up metabolism and raises blood flow, sometimes leading to pulsatile tinnitus. When arteries harden due to atherosclerosis, turbulent blood flow occurs, creating the sounds associated with this condition. Blood vessel abnormalities, such as arteriovenous malformations or abnormal pouches called diverticula, can also cause pulsatile tinnitus. Tumors like glomus tumors, which are highly vascular, can press on blood vessels near the ear and produce pulsatile sounds. Elevated pressure around the brain, known as intracranial hypertension, can narrow large veins that drain blood from the brain, causing blood to flow through restricted spaces and generate pulsatile noise. Other factors include head trauma, narrowing of blood pathways, or bone disorders like Paget's disease. If you notice pulsatile tinnitus, it's important to see a healthcare professional for a thorough evaluation. An otolaryngologist, a specialist in ear, nose, and throat conditions, will examine your ears, check your pulse, and may order imaging tests like ultrasound or MRI to look at blood vessels and identify abnormalities. The symptoms can change with your position. Lying down, turning your head, or applying pressure to your neck can alter the sounds, providing clues for diagnosis. Treatment depends on finding and addressing the root cause. For example, if increased intracranial pressure is involved, medications or procedures to relieving pressure may be used. Tumors or blood vessel malformations might require surgical or minimally invasive procedures. When blood flow issues are due to narrowing or blockages, doctors may recommend specific interventions to restore normal flow. Managing underlying health conditions like anemia or thyroid problems can also reduce symptoms. Besides medical treatments, some people find relief through sound therapy, relaxation techniques, or cognitive behavioral therapy, which help lessen the impact of the noise on daily life. Remember, pulsatile tinnitus can sometimes resolve on its own, but because it may signal serious health issues, such as blood vessel problems or tumors, prompt medical attention is essential. If you experience this rhythmic noise, consulting a healthcare professional ensures proper diagnosis and personalized treatment. Always seek advice from qualified medical providers to address your specific situation safely and effectively.